We're going to be assessing Morton's neuroma, also known as Morton's metatarsalgia, interdigital neuroma, with the Mulder sign or the Mulder's click. The patient will be short sitting on the edge of the table. The clinician will be in front of the patient. One hand is to palpate between the metatarsals, other hand around the forefoot. The procedure is palpating between the metatarsals on the plantar surface. Typically, the pain should result from the plantar surface, not the dorsal surface. The differential for this is on the dorsal side. If there is pain there, there may be a stress fracture, metatarsal phalangeal synovitis, or dorsal neuralgia. But the positive sign for Mulder's sign is feeling a click or patient has pain, numbness, or tingling resulting from the plantar surface. We're going to be assessing the plantar fasciitis with the plantar fascia test. The patient's going to be in long standing. The clinician's going to be in front of the patient. One hand's placed on the plantar surface of the toes. Can start with the big toe. The second hand is palpating on the medial tubercle along near the calcaneus, and we extend the big toe, thus tightening the plantar fascia. Proceeds to elicit symptoms through palpating of medial calcaneal tubercle distally, and if there is pain upon extension of toes, there is pathology with the plantar fascia. We're going to be assessing for the navicular drop, flexible medial longitudinal arch, or excessive pronation with the navicular drop test. Patient's going to be standing, clinician's going to be in front, side of the foot, and we're going to mark the navicular bone and then measure how far that is from the ground. Be 4.5, and then find the subtalar neutral. Have you supinate a little bit, come back, there you go, stop. And that is 5 centimeters, you find the difference. And with that in mind, a drop of more than 10 millimeters is a sign of a navicular drop. A drop less than 3 millimeters is also a sign of tight or other pathological sign of the medial longitudinal arch. We're going to be assessing posterior talofibular ligament tear or laxity with the posterior drawer test at the ankle. We're going to have the patient long sitting. The clinician should be in front on the side of the foot. And we're going to be stabilizing at the distal tib fib and providing a posterior force at the proximal ankle. And if there is an excessive posterior translation or pain with this movement, then there may be possible posterior talofibular ligament tear. Now we're going to be assessing the most associated with the inverted ankle sprain, which is the anterior talofibular ligament. To assess that, we're going to be doing the anterior drawer test. Clinician's going to be on the side of the affected ankle. We're going to stabilize at the posterior distal portion of the tib fib and then provide a anterior force. We're going to be assessing the anterior talofibular ligament. Now we're going to be doing a general test, a more global test at the ankle. It's going to be called a rotation test. With this one, you're going to be stabilizing at the distal tib fib with the patient in supine, and we're going to grab the distal hand will be grabbing the calcaneus and our forearm supporting their forefoot. And we're going to be doing internal and external rotation. Internal rotation, you're testing out the lateral ligaments, anterior talofib, posterior talofib, and the calcaneal fib. On external rotation, you're testing out the deltoid ligaments. To assess the calcaneal fibular ligament and also the deltoid ligament, we're going to be doing the Varus stress test and the Valgust stress test at the ankle. We're going to have the patient lying in supine, and clinician's going to be on the involved leg side. One of our hands will be gripped around the navicular tubercle, and the other fingers are on the cuboid groove. Proximal hand is stabilizing at the distal tib fib. For the Varus stress test, we're going to be bringing the ankle and foot medially to assess the calcaneal fibular ligament, and the Valgust stress test to assess the deltoid ligament. To assess the deltoid ligament, we do the Kleiger's test. We're going to be having the patient lying in supine, stabilizing the distal end of the tib fib. We're going to grasp the forefoot, externally rotating the foot to assess the deltoid ligaments. To assess a few pathologies at the ankle and distal portion of the tib fib, we're going to be doing the tap test. We're going to have a patient lying in supine and one of our hands, we're going to bringing their foot into slight dorsiflexion and applying a mechanical stress to the calcaneus. And we're going to have them slightly dorsiflex to align the calcaneus with the tibia, and then applying a mechanical tap to the calcaneus to assess if there's a bone bruise out of the calcaneus, a calcaneal fracture, a tibial fracture, or a syndesmosis sprain based on where the pain is coming from. To assess for lower leg diastasis or fractures, then we can do the compression and distraction test. We're going to have the patient lying in supine. Condition is going to be on the side of the affected foot. We're going to start proximally, and we're going to be compressing down the leg and assessing for tibia or fibular fracture. And then we're going to be trying to distract between the syndesmosis, and if there is a pathology there, then there may be a diastasis. We're going to be assessing ankle effusion with the figure 8 anthropometric measurement. We're going to start with anterior tibialis tendon on the centimeter side and going down to the navicular tubercle around the plantar surface, cuboid groove, anterior tibialis tendon again, crossing over it, distal to the medial malleolus, proximal to the calcaneal dome, distal to the lateral malleolus. And for this measurement, we have 57 centimeters. The Ottawa ankle rules is so that you can determine if the patient needs to have imaging done on their ankle. And they are, if the patient cannot ambulate for 4 steps, if distal 6 centimeters, posterior lateral malleolus or medial malleolus has tenderness there, pain, or if there's pain at the navicular or pain at the 5th metatarsal bone.